Welcome everyone, and thank you for joining us today. I'm excited to introduce our presentation on fracture coding in ICD-10-CM. Today, we'll explore the different types of fractures, review the ICD-10-CM fracture coding guidelines, discuss coding sequencing, and work through some practical coding examples. We'll also cover the latest updates in fracture coding to keep you current. So, let's get started and step into your success with this important training. A fracture is essentially a break in the continuity of a bone. It can happen for a variety of reasons, with common causes including trauma, falls, accidents, and conditions like osteoporosis that weaken the bones. When medical coders are working on these cases, they need to be very precise. They must identify which bone is involved, determine the laterality, meaning whether it's the left or right side, and understand the specific type of fracture. Additionally, they need to note the encounter type, whether it's an initial visit or a follow-up. Recognizing all these details is crucial because it ensures accurate coding and proper treatment documentation. Remember, understanding what a fracture is and how to classify it is a fundamental step in the coding process, helping us step into our success in medical coding. All right, let's dive into the different types of fractures. First up, we have the open fracture, which is when the bone breaks and pierces through the skin, increasing the risk of infection. Then there's the closed fracture, where the bone is broken but the skin remains intact. Moving on, a displaced fracture occurs when the broken bone ends are out of alignment, often requiring realignment for proper healing. In contrast, a non-displaced fracture is where the bone cracks but stays in its normal position, making it easier to treat. We also have pathological fractures, which happen in bones weakened by disease, such as cancer or osteoporosis. These are a reminder of how underlying conditions can influence fracture risk. Stress fractures are tiny cracks caused by repetitive stress, common in athletes or those doing high-impact activities. The greenstick fracture is unique to children. It's like trying to bend a young, flexible twig, partially broken but not completely snapped, usually on one side. And finally, a comminuted fracture involves the bone shattering into multiple pieces, often resulting from high-energy trauma. Understanding these different types helps us grasp the complexity of fractures and how each one requires a tailored approach to treatment. It's a key part of managing bone injuries effectively. Most fractures are coded from Chapter 19, which covers the range from S00 to T88. When coding fractures, it's important to use the 7th character to specify the encounter type, such as initial, subsequent, or sequela. This helps provide clarity on the stage of treatment. Additionally, identifying the laterality is crucial, whether the fracture is on the right side, the left side, or if the laterality is unspecified. This detail ensures accurate documentation and coding. Lastly, be aware that combination codes are used to describe both the site and the type of fracture. This means that sometimes a single code can capture all the necessary information, streamlining the coding process. Overall, understanding these key points helps ensure precise and consistent fracture coding, which is essential for proper documentation, billing, and statistical analysis within the overall coding guidelines. Let's walk through the different stages of fracture encounters and their significance. First, we have the initial encounter for a closed fracture. Labeled as A, this is when a patient first presents with a fracture that doesn't break the skin. It's usually straightforward to assess, but still requires careful management to promote proper healing. Next, we have the initial encounter for an open fracture. Designated as B, these are more complex because the bone is exposed through the skin, increasing the risk of infection and complicating treatment. Immediate intervention is crucial here to prevent complications. Moving forward, we come to subsequent encounters. The first is routine healing. Marked as D, this indicates the normal, expected process where the fracture is healing as planned, with callus formation and bone remodeling. Then we see a delayed healing scenario. Labeled G, this suggests that healing is taking longer than usual, which could be due to various factors like inadequate stabilization or poor blood supply. Detecting this early helps us implement strategies to promote recovery. Following that, we have non-union. Indicated by K, this is a more serious problem where the fracture fails to heal altogether, often requiring additional interventions such as surgery or bone grafting. Next is malunion, marked as P here. The bone heals, but in a misaligned position, which can lead to functional impairment or deformity. Correcting malunion often involves corrective procedures. After these healing stages, we reach the sequela. Represented by S, this encompasses the long-term consequences or complications that may arise after a fracture, such as chronic pain, deformity, or joint issues. Finally, the seventh character for fractures helps us classify these different encounter stages and healing progressions systematically. Understanding these stages allows us to track the patient's healing journey accurately and tailor our treatment strategies effectively. When coding fractures, it's important to remember to code the fracture as the principal diagnosis when it's the main reason for the patient's admission. This helps ensure the primary concern is accurately documented. If there are any complications related to the fracture, use additional codes to capture those details properly. For pathological fractures, you may need to code the underlying disease first, since that's often the root cause. And in cases of sequelae, make sure to code the initial injury first, followed by the residual condition. Understanding these sequencing rules is crucial because they help us communicate the patient's condition clearly and accurately. They're an essential part of the overall coding process, ensuring the documentation reflects the true clinical picture. Now, let's look at the diagnosis for this case. We have a closed fracture of the shaft of the right tibia, and this is the initial encounter for this injury. The ICD 10 cm code assigned is S82201A. It's important to note that the fracture code is listed as the principal diagnosis, meaning it's the primary reason for the patient's visit. For this example, we're focusing on a closed fracture, which means the bone broke but didn't pierce the skin. Understanding how to properly code and document these injuries is crucial for accurate medical records and billing. This slide emphasizes the importance of correctly identifying the type of fracture, closed in this case, and ensuring the initial encounter is properly coded, as this impacts patient care and administrative processes. Throughout our presentation, we've been highlighting how precise coding reflects the clinical scenario accurately and supports effective communication across healthcare teams. Today, we're looking at a specific example of diagnosis, which is an open fracture of the left radius. This type of fracture involves a break in the bone that's exposed through the skin, making it more complex and requiring prompt attention. The ICD 10 cm code for this injury is S52502B, where the B at the end indicates that this is an initial encounter for treatment. It's important to note that accurate coding like this helps ensure proper documentation and billing. When we talk about open fractures, it's crucial to understand that they often involve higher risks, such as infection, due to the exposed bone and tissue damage. Proper diagnosis and coding help communicate the severity and specifics of the injury to healthcare providers and insurance companies alike. This example ties back to our overall theme of understanding injury classification, highlighting how detailed coding reflects the injury's nature and guides treatment decisions. Being precise with these codes ensures that patients receive appropriate care and that all aspects of their injury are accurately documented. Now, let's take a closer look at the diagnosis for this case. We are dealing with osteoporosis accompanied by a pathological fracture of the vertebra. This is identified with the code M8008XA, which specifically indicates osteoporosis with a current pathological fracture. It's important to remember that in cases like this, the fracture occurs because the bone has become weakened due to osteoporosis, making it more susceptible to fractures even with minimal trauma. When documenting or coding such cases, we often need to indicate if there is an underlying condition contributing to the fracture. If applicable, we should sequence the underlying condition first to ensure accurate coding and understanding of the patient's health status. For example, in this case, The vertebral fracture is directly related to osteoporosis, which is the underlying condition. Recognizing this relationship is crucial for proper diagnosis, treatment planning, and coding. Overall, this slide emphasizes the importance of correctly identifying and coding osteoporosis with a pathological fracture, as it impacts both patient management and healthcare documentation. Remember, these details help us provide comprehensive, accurate care and ensure proper billing and reporting. Let's talk about the final step to ensure your coding is spot on. Always review the radiology reports carefully. This step is crucial because it confirms that your documentation matches what the radiologist has found. Next, check the report for details on the fracture type and the encounter. It's important to understand exactly what kind of fracture you're dealing with and the context of the visit. Make sure the 7th character extension is correct. This tiny detail can make a big difference in the code's accuracy. Lastly, verify the laterality and the healing status. Knowing whether it's the left or right side and whether the fracture is healing or healed helps ensure your coding is precise and comprehensive. Remember, thorough review at this stage is key to success in medical coding. Step into your success by mastering these final checks.